Ladies and gentlemen, welcome to the third Community Forum hosted by Estill Development Alliance. My name is Joe Crawford. I'm Executive Director, and we appreciate you joining us. Got a hot mic. But tonight we're focused on community health issues, and we are excited to have a great group of experts talking to us this evening. I'm joined here directly next to me is Mr. John Isfort, and he's the director of the Project Home Network. And then we've got Trena. She is the president of Mercy Health, Markham and Wallace Hospital. And then we have Mandy Watson. She is a registered nurse at the Estill County Health Department. So thank you all for joining us.
Thank you, Joe.
All right, definitely. All right, well, we're going to kind of bounce around just a little bit, but there are a lot of issues concerning health in the community. Some people jump at the chance to talk about, and some folks don't really want to talk about. If it's all right, I'd like to start with you, Trena. And everybody that's had a chance has wanted to talk to you with your new role as president at Markham Wallace. So, kind of give us the dime tour, if you will. What does the community need to know about our hospital? Why is it important that we have a hospital? And what are you looking forward to as you move forward in your new role?
Well, one of the first things that I think is so important for the community in realizing that we have a hospital and to use the services is because rural healthcare is a need. And individuals that live in rural communities have the same and they have different needs than those living in the urban areas. At the hospital, we're a full-service hospital. We have the emergency room. We have inpatient, outpatient services. We do a lot of diagnostic exams. For example, we have the 3D mammography, which is funded partly by the community as a community project. And then we're also CT lung accredited, which is very important, especially in this area with the high risk of cancer and smoking. So those go hand in hand. But one of the big things, and that's why it's such a great thing to have all of us here, is we can't succeed as a hospital without the partnerships of, for example, Project Home and the primary care practices, the health department, and all the other healthcare entities that are here in the area.
Very well said. That's a nice plug for the folks at the table. Like I said, I'll bounce around a little bit so nobody's on the hot seat too long. But John, this is, I know, not an easy question to answer concisely, but what exactly is Project Home?
Well, thanks, Joe. It's not easy, just in a couple of minutes, really. But Project Home is what we call a rural health network. Mm-hmm. Now, so really, what is a rural health network? Well, we really come together as healthcare entities within the community for the purpose of collaboration to be able to provide better health care and to provide better access. Mm-hmm. And as Trena alluded to, there's no way that we can do that alone. And what we try to do with a network is to collaborate to talk or to tackle some of these tough issues that we have. So Project Home was born out of that concept. Originally, before we had the Affordable Care Act, we had a high uninsured rate in this area. So that meant that a lot of people had difficulty accessing health care. Right. So it was really born out of that issue about 12 years ago. So partners came together. We started out with about 7 partners in 3 counties. And actually, when we first started, we had 7 counties. We had to narrow that down just a little bit because it was not manageable. But now we're Estill, Lee, and Powell, mm-hmm. and we have 18 agencies. I think we're bringing the 19th agency in, and it is comprised of everything from primary care, the critical access hospital, through EMS, behavioral health, and public health. And as you well know, the Chamber and EDA brings that business perspective to healthcare. So to collaborate and ensure that we all work together, not in silos, but work together to be able to provide that good quality health care in a rural environment.
Good job. We'll have to cut that out and put that in some sort of promo video somewhere. That was well done. Well, Mandy, you're representing the Estill County Health Department. if I could just ask you a general question, as we've been doing sort of intros here, what does the health department do? I know there are a lot of folks out there who may have never accessed any of the services that our health department offers. So what are some of the services that are offered?
Well, thank you for having us all here.
Sure.
We do offer a lot of different services. Some are very similar to what other healthcare providers offer. We do offer family planning. We offer WIC services for women, infant, and children. We offer, there's pregnancy things that we do there. One of the newest things that we just started was the harm reduction program. We've just got that off the last couple of weeks. We have our HANDS program that's there, and of course the environmentalists, we've got preparedness. So there's a lot of different things that we do that's community-based,
Right.
not just healthcare-based.
And that's when folks start talking about public health, the first thing they're talking about is your local health departments. There's a lot of pieces to it, but that's your go-to.
Yes.
Well, and thank you for being with us as well. Trena, I'll come back to you. One of the buzzwords that gets used a lot when talking about Markham Wallace is the Level 4 Trauma Center certification. And I'd be remiss if I didn't drop her name at some point, but Susie Starling basically had that on a big flag that she carried with her everywhere that she went. Since that certification was achieved. So it's a big deal, and we were the first in Kentucky.
Very much
So what does that mean, and why should people care?
First off, it's the epitome of a network, because that's what the trauma program is a network of facilities within the state of Kentucky. Now, some of those are the level ones, like University of Kentucky, University of Louisville, Pikeville, and there's a couple of others. But it's also that access point. So for us as a level 4, we can bring you in, we can stabilize you, and then get you to that care, that definitive care, which for us, our automatic acceptance is University of Kentucky. So we're going to send you there and stabilize you. You know, when you talk about the trauma network and you start talking about some of the stories, we were just actually compiling some patient information back earlier in November when we got our re-verification. But, you know, we've had everything from a 4-year-old that took a wrong turn through the glass door that he thought was open and it was not. And we stabilized him and got him a helicopter ride at, you know, just 4
Right.
years old. We have truly saved the lives of individuals. We have members that are engaged in our hospital board because of the importance of the trauma network. And I love nothing more than getting a Facebook post that said, "You saved my husband's life last night."
Right.
Because we did, because we were able to stabilize him and get him to that next level. What was great about being the first, and obviously it was before my time, but we are recognized for setting that standard, and we still are to this day. When they were back in November for what would have been our third re-verification, it was, forms were being shown to us that were actually created by Janet Smith and actually
Right.
John at the time as, well, this is a form we use in Danville, or this is a form that we found out Bowling Green uses. It's like, well, yes, we've seen that form, we created it. So that's what's great, is that they were able to take our processes and replicate them statewide. And then we actually took some of those same processes, and that's what we've used for chest pain accreditation and stroke, because it is all about the process, not the people, it's about the process, and that's what helps maintain it year after year after year.
Right. Well, and as a quick follow-up, you mentioned the chest pain accreditation, and then working on stroke accreditation. And what do those accreditations actually mean?
They mean that we deliver the best care for the level of hospital that we are. For most of the time, that is, for example, for chest pain, we get you from the time you come in to the time you come out. We get you within 30 minutes as a standard. Ours is about 19 minutes right now. For certain cardiac conditions, stroke, it's within 60 minutes, and we're at about 42 minutes. So we have that process. We get you to the door. We treat you, we identify it. And then it also involves having that automatic acceptance somewhere, whether that be at university for our trauma. We send a lot of neuro to University to, and then our cardiac goes to Baptist Health.
It's almost like that Good Housekeeping Civil Improvement.
There you
Yes,
go.
there you go.
Okay, okay. Well, I want all you all, especially who are watching at home, to pick up on the sweet, understated sort of, brush the dirt off your shoulder that Trena had right there. 30 minutes, we're currently at 19, and 60 minutes, we're currently at 42, and it's, yeah. But I appreciate that, just right in line. Well, John, as far as Project Home goes, the network as a whole, I know one of the parts that I was most involved with was working on helping folks find that medical home. Of course, that's where the acronym kind of came from. There are multiple sort of tentacles that have grown out of the Project Home network, and I know one that most folks will find the most intriguing is the most recent endeavor, which is another acronym, HELP.
Yeah.
So please tell folks a little bit about HELP.
Well, we like our acronyms.
Medical,
That's right, it's medical. HELP stands for the Healing, Empowering, and Living Program. And really what that program is a holistic approach using the community, of which are partners, which Mandy and the health department are a partner. I see Mr. Saylor there, as well as the school, and 17 other partners. Holistic approach to the whole substance use disorder, opioid use disorder problem that we have. Project Home is really the arm of the hospital that receives most of the federal funding to work these community-based programs that we're working now. We have 3 federal grants, and it's through Home because it's a network again, right. And it's all of these agencies collaborating because we feel, and research proves that if you work together, you can accomplish much more than if you're working by yourself in a silo. So Project HELP is in that planning phase to actually combat what we see in Estill County. Some quick statistics for you. In 2017, one of the things that we had in Estill County that obviously we're not proud of, and that's why we have HELP and everybody working together, so we had the highest overdose death rate out of all 120 counties in Kentucky. So that helps put things in perspective with some of the issues that we're facing with this opioid crisis. And some of the good things that Mandy and the folks are doing at the health department, she can talk about that. But that program is designed to be able to help a person get not only the initial medical treatment, counseling, all the things that go with that medical component, but be able to get housing, transitional housing, job skill development, those things that are going to make your recovery successful in the long run. So that's what we're doing, and it takes multiple partners to do that.
Excellent. Boy, you're good at summing things up. I'm impressed.
I've done it a bunch.
Well, that was a nice segue, Mandy, and a hot topic. This is very timely, been in the news a lot lately. And you made reference earlier, but it's the difference in common vernacular and what things are actually called. But the needle exchange is what folks commonly refer to it. I've got the paper right here. Harm reduction syringe exchange. That's the proper name. So exactly what is the program all about, and how can it help? What are the intended effects here in Estill County?
Mainly what the harm reduction program is about is kind of like what John and Trena have touched on a lot. You had asked me a question earlier about what some of the programs were that the health department offers, and what I didn't mention was reportable diseases. Diseases spread very quickly in a community where there's drug use involved, and hepatitis is a very big one in this community right now. There's not a day goes by that I don't have a hepatitis case come across my desk. I do all the hepatitis, or all the reportable diseases for the county. What people don't realize is sometimes they may think, well, I can go out of the county or I can go out of the state and be tested, but if you have a disease that gets reported that is spreadable to someone else, it's still going to come back to the health department of the county that you live in.
Right.
And so you'll be getting a phone call from me. So, because we have to track those. Those are the things that we have to do. And so the harm reduction program helps to reduce those reduce the spread of diseases. are trying to get needles off the street and keep officers from getting stuck, keep our EMS from getting stuck. We don't want, when they go to the hospital, we don't want the nurses and the doctors at the hospital being exposed to things that they don't have to be, if we can stop that on the lower end of it. They kind of take care of the end of it once they're hurt or once the overdoses happen, those kind of things. But if we can start on the lower end and start preventing that harm and reducing all of that, then that just kind of makes it a little bit easier for these guys when they get them on the other end.
Well, as a follow-up to that, I know one of the most frequent responses that I've heard, well, it sounds to me like you're just putting more needles out there. So what's your answer to that?
That is a question that I get a lot, or a statement that I get a lot. There has been no research ever proven that a syringe exchange program puts more needles out on the street. In fact, the CDC has actually done over a 20-year research, and it has been proven that more needles are coming back off of the streets through the syringe exchange program. And it's also been proven that a person that is a participant of the syringe exchange program is 5 times more likely to enter counseling than a person who's not using a syringe exchange program. And in the end, stopping the spread of diseases is what we want to see happen, but we want to see people end up in rehab and counseling as well, whether it be inpatient or outpatient. We want to see treatment happen. And what people don't realize, I think sometimes on the back end of everything, you know, with the syringe exchange program, they see, well, they're bringing in needles, they're getting clean needles. But they don't see everything that goes on behind the scenes, which is what the hospital does, what Project Help does, all the things that are going on in the community that people have come together to help prevent a lot of these things. John has also started the drug task force, and several people in the community have joined that task force, including myself. And we meet every other week, and we talk about what's going on in the community, the overdoses that are happening, how can we fix these issues, what can we do better as a community, as a whole. And so it's not just having somebody come in and bring in dirty needles and get clean needles. It's all the other stuff that goes along with it that all the community partners are working together to help prevent.
I think that's a big part of it that a whole lot of folks just don't have the information about.
Exactly.
Is this is not a standalone entity, that it's just part of a bigger effort.
And the sad thing is you hear so many people say, and I'm sure these guys have heard it as well, you hear so many people say, well, these are people who's using drugs. They don't do anything. They don't care about anybody. They've hurt everybody they love, so why should we care about them? And the truth of the matter is they're people just like we are. They just have an addiction that we don't have. And so if we give up on them, then who else is going to be there for them? They have to have a safe place that they can come to and know they're going to get help without being judged. And that's what a syringe exchange program does. That's what this help program does, is it helps providers understand how they think and how they work and what's going on with them, so that when they come and sit down with them, they know how to treat them with respect. And a lot of times we have that stigma that, you know, we know what a drug user looks like, or we know how they act, or you know, we know what to expect, when in fact we don't. We don't, because it could be your doctor that you're going in to see could be a drug user. It could be your banker. It could be anybody that you come in contact with. And so you don't know what they look like. And learning how to treat people with respect and teaching them when they come in to see you how to stop the spread of diseases is the best thing that we can do for our community.
Well, and if you can't tell by the sound of her voice, Mandy's obviously quite passionate
Very.
about this. So,
Very.
well, I've got a couple more questions for you here in a moment. I want to have Trena perhaps answer a question that some folks have had. The hospital recently went through a rebranding of sorts. There was some movement on the corporate level. So actually, and I've learned it so well thanks to you now, Mercy Health Markham and Wallace Hospital is the official name. Being a part of Mercy, which actually just got bigger recently.
We actually just got international. We acquired 5 hospitals in Ireland as part of the Bon Secours Mercy Health book of.
Now, do you get to do some sort of exchange program? Or?
We haven't heard of anything yet,
Okay.
but there's a big majority of us that would be game to head on over there to
Yeah.
look around.
I'm sure if anybody gets to go, it'll be John.
Yeah,
There's
there
not.
you go.
But with that affiliation, what does that mean for our little hospital right here in Little Old Irvin?
One of the things that being part of Mercy Health, which we have been for a very
Yeah, right.
long time, Mercy Health used to be Catholic Health Partners, and we have been part of them for years. But when we are part of a bigger system, there are processes and improvements that we might be able to gain that we wouldn't have been able to get on our own, just because as a system, and especially in 5 different states now, if something is decided on, for example, the electronic medical record of Epic, it looks a lot better to Epic to put it in 50 hospitals and over 3,000 care sites than it does to put it in Markham and Wallace. So there is benefits in that. There's also benefits in, as we develop programs, for example, or we look at service lines, somebody out there is doing it. It could be somebody in Richmond, Virginia, in one of our Bon Secours markets, Cincinnati, Toledo, and reaching out to that subject matter expert that we may not necessarily find here in our local community, but that can work with us and partner with us on what those processes are. And I know Project Home, and especially HELP, has been able to reach out and visit some of our other sites. And when we were going through chest pain accreditation and then into stroke accreditation, we've had people from other Mercy sites in Cincinnati and at Lourdes work with us and say, this is what we did during our journey. And then we've had a couple of the smaller hospitals reach out to us because Ohio does not have a level 4 designation, and just what does that mean? What does that look like? And maybe even inquire as to how do you even get it started.
Very cool. So it gives you a much larger family to call when you've got
Very
something.
much so,
Yeah,
A lot of
yes.
resources.
that's very neat. Well, John, I want you to, in your summary fashion, dive a little bit deeper into. I know when HELP was, the grant was first awarded, and you're kind of going around and trying to get everybody to circle the wagons and get on board with this, and you brought me a one-page document with a graphic on it that was a big ring with all these different pieces, and it really spelled out to me the holistic approach to trying to break down some of those barriers that folks dealing with addiction sometimes get stuck with. So could you just expound a little bit more on that holistic approach and kind of the different directions that you're coming from?
Sure. I think if we look at it, a person, when we look at healthcare and when we talk about holistic healthcare, it's really mind, body, and spirit. So, the body portion of it is taken well care of by our medical team, physicians and nurses and things of that. The mind, though, to be able to unravel some issues that people have, that's our behavioral health care and the counselors that do that. Then there's a spiritual component to it, too. And so that's all involved in the program that we want to do. So when you look at the body, it's obviously with what some of the things that Mandy is doing is prevention. So we want to prevent some of these issues, and we start that very early in the school system. Some of our other partners, ASAP, I know you're familiar with that. Obviously the health department, some of our grant funding is going toward prevention. So you want to prevent it. If you don't prevent it, you want to treat it. Okay, so that treatment, some of the things that we have done is that all of the local police and the sheriff's department and the fire department, they now have a first responder program with Narcan. And just recently, within the last few months, they actually responded and revived somebody. So that component of it, again, the community involved.
Right.
That's the medical side of it. And also looking at treatment with medication out of the emergency department if someone comes in. Further counseling, working with, it used to be bluegrass.org, now I think it's
New Vista.
New Vista, and that's our community mental health center locally, and West Care and those places to provide that counseling. So really what we want to do with it, we have a person called an addiction recovery coordinator. So that's a one-stop shopping. So if you need housing, they know the people to get you to housing. You know, we've already got a system. We're going to have protocols set up for medication-assisted therapy. That's medication to help you with the addiction, to maybe ultimately get you to the place where you're abstinent. But if that can't be, then there's other medication that can help take care of the cravings in that. So it's a well-coordinated, it's like you said, it's the circle with the arrows going out. It's well-coordinated. You know, many people come out of addiction, they have a difficult time getting a job, they need some skills training. We've worked with the school system, adult education. Many people don't have a place to live, or if they do have a place to live, it's not a place that's conducive to recovery.
Right.
So that's a system that we're setting up. So really what we want to do is we want to be a one-stop shop. That addiction recovery coordinator can get the person everything that they need. If they come into the hospital, then there's a process for them. We also are developing what's called a quick response team, where if someone overdoses, we actually send a crew out to encourage recovery and see what resources they may need. But I guess if I could sum it up, it's a one-stop shopping for this, is what it is.
That's kind of neat. I hadn't connected the dots until just now, but you really changed the original healthcare navigator idea to really hone in and be specific to dealing with addiction, and that's, yeah. Why didn't you come up with this sooner?
I guess, you know, big problems require big solutions.
That's right, that's
But we
right.
have peer support specialists within this, and behavioral health counselors. These are folks that are gonna be located in the ED, so it really covers all bases here in our little community. And the only way we can do that is, like Trena said earlier, is we do it collaboratively with all the agencies in the community
Right.
here. It's a community problem. It takes a community to solve it.
It's a really cool thing. I mean, at the end of the day, you know, having, well, and I guess education is such a huge part of it, just so to let people know where to go, you know, when they're ready for help, literally and figuratively. They know where to go and to get plugged in and be sent in these directions, because hitting those roadblocks, you know, can be the difference between finally moving forward and falling right back.
That's correct, yeah. You know, those barriers that pop up along the way can really make you relapse.
Sure.
So we're trying to remove those barriers.
It's really neat. It really is, and I look forward to seeing what continues to evolve as we move forward.
And Joe, if I could just say this, like with what John was talking about, if we have somebody that comes through the Strange Exchange Program and they tell us, okay, we're ready to get help, we're ready to find a cure, a way out of this.
Right.
We need to have somebody like the hospital, like this project home, that we can call up and say, hey, we've got somebody that's ready right now. Let's get them started with this, because if we don't have that in the community and we send them home and say, okay, we'll do some research, we'll try to find you a place.
You've lost the
Then
moment.
the very moment that they
Right.
leave, you've lost that option to help them. And 9 times out of 10, they go back home in their environment around their friends and their family, and they all of a sudden don't want to quit.
Right.
They don't want to stop anymore. And you may never get them back. And so if we don't have that, you don't have the option to help people the way
Right.
that you need to.
Well, let's talk nuts and bolts with you for just a second.
Okay.
So how does the syringe exchange work? And when somebody is interested in taking advantage of it, then how do they do so?
What they would do is they come to the health department. We're open. We'll have it open on Mondays from 10 to 5:30. That's what we're starting with. We're hoping eventually it'll lead to more days than that. But they'll come into the front window. They don't have to say their name. They don't even have to speak. They'll be handed a piece of paper. They mark on the paper what they're there for. They just check it off, and then they hand the paper back to the clerk. They hand them a number and ask them to have a seat. They'll come back and bring the number back to us in the back. We'll come out and call them by number, not by name. But that we also have that fixed now to where all of our patients
Right.
are being called back by a number.
So they could be there for anything.
Exactly.
Yeah.
So nobody ever knows why they're there. When they come back, we sit down, talk to them, get a few little, things for data collection, that kind of thing. We talk to them about their drug use. It's a way to build trust with them and find out their story.
Sure.
Find out why they started using. if you can find out the reason why they started, you may be able to head that off in the future. That may be something we can pass on through Project Help and say, hey, these are some things that they are facing. These are barriers in their lives. How can we help them to fix that? So if we can get them help, they don't come back out to those same barriers.
Right.
And so it's just a way to build the trust with them and you know, work with them on that level. And then we give them the supplies that they need to use to keep from spreading diseases. And we talk to them about how diseases are spread through their drug use. And then once we're finished with them, we allow them to leave out the back door if they would like for privacy, or they can go back out the front door, you know, whatever makes them comfortable.
Right.
They'll be given an ID card that'll have a unique ID number that's specific for each participant. They'll be explained to, you know, how officers will be able to recognize that ID with their driver's license if they get pulled over, to know that they are a member of the program. So that way if somebody takes their card or something, that, you know, they can't say that that's them and the officers not know.
Right.
But we work with our law enforcement very closely to make sure that, you know, if somebody gets pulled over, they're not going to get charged for their syringes. We do explain to them if they've got any other paraphernalia on them, that they can be charged for those
Right.
items. If they have drugs on them, they'll be charged for those, but not the needles themselves, as long as they let the officers know up front that they have needles on them. We explain to them that, you know, if the officer asked if they've got anything on them and they say no, they're fair game for that. So,
Right.
because they've just, you know, told them that they weren't. But we try to explain all of those things to them and build that rapport with them. And then when they leave, hopefully they feel comfortable enough to come back, and eventually we can hopefully offer them into treatment.
Right. So there you go. That's how it works. Well, something that that's popped up several times, moving back to Trena, a lot of folks don't understand the hospital foundation, because Markham Wallace is a nonprofit hospital, but then there's also the hospital foundation. So could you explain kind of what the difference is and what the foundation does?
So the foundation essentially is part of the hospital. They're a group, we have a foundation board, there's community members on that board that value the hospital and see the value of the hospital, as well as ensuring that the hospital can provide the services and the access that's needed in the community. So what that board does, and it's led by Ariel Estes as our director of the foundation, they identify projects and needs that can engage the community. For example, the 3D was a 3-year project for us to look at having annual events and fundraisers, and it brings the equipment and the supplies in. That's not to say that Mercy would not have done that, but it's an identified need, very specific
Right.
for us. And then what we do when we look back is we look at projects that they've done. The helipad is something that the foundation was involved in. They've redone the rooms. We have angel carts, which we hear from families constantly that are at the end of life. That's a lifesaver, so they don't have to leave. That was donated by not only different individuals in the community, but businesses in the community provided services, and there's a coffee pot on it and a microwave, and that family can stay with that loved one in the last little bit of their life versus worrying about needing to go get something to eat. And we've also done, for example, the ultrasound for not only the carotid, for anybody that's gone to the Mushroom Festival and Sharon has done their carotid, that was a purchase through the foundation, but it also allowed us to buy something that we use in the ER for our trauma patients. It's an ultrasound, but it's a fast exam for identifying very quickly if there's been abdominal trauma. So the foundation not only supports big global projects, but it can be connecting the dots of this is a great piece of equipment to help us with our trauma program, so the foundation works on that.
Right. Well, and that was a good description there. And I know which the big fundraising event for the foundation.
September 28th.
September 28th.
At the golf course.
It's the region's premier charity event. If you don't believe me, just ask Ariel, because she grabbed that title and hung on to it.
This will be our 5th year.
That's
We were
wild.
all talking about that, but this will be the 5th year for the luau.
And I know the focus on the fundraising this year is actually on beds.
Correct.
And what is it, the bariatric?
The bariatric
Right.
bed, one of the patient populations, especially for our swing bed or our post-acute program, that we find really is a struggle for a lot of places to accept, and we gladly accept, is the bariatric population, and not just a bariatric population, but 650, 700, 750, 800 pound patients. With that population, you can't just buy something bigger. I mean, it's a whole program. And
Sure.
so we've looked at our bariatric program and ensured that we have lifts and beds and walkers and wheelchairs. Even the lovely yellow socks you get guaranteed when you come to the hospital, those can be a different sizes, gowns. So
Right.
looking at that bariatric program, and that is one of the things that they're gonna work on, is a bariatric bed.
Well, and I know one of those beds, I can't remember the exact number, but it was upwards of $20,000.
23,000
Yeah.
for a bariatric bed.
So
Yes.
that's just not chump change laying around. You've
No,
got
it's
to
not.
really focus on that. Well, John, I want you, you currently wear multiple hats and have worn quite a few hats over the years. And I know currently you're also, let's see, are you chairman of the EMS board, or you're on the board?
Well, yeah, both.
Okay,
Yeah.
all right, well, but you not only have preached the the cooperative approach to trying to tackle some of these issues, but you've lived it and tried to put on those different hats and wade into the different silos. Is it, because I know you've traveled quite a bit as well, with both with grants and training and that kind of thing, and dealt with healthcare professionals all over the place. How unique is it for a community like ours to have such a level of cooperation?
That's a good question, and what I would say to that, Joe, it's very unique. Everybody always feels like their community is connected, and they want to tackle problems, and there's always a group in every community that's doing that.
Right.
But throughout travels and things throughout the state, I have seen that, and the cooperation that we have here, particularly in Estill County, but not only Estill, in Powell and Lee County, I think is really second to none. That I've seen certainly in Kentucky and even other places in the country. We don't try to toot our horn, but
Sure.
But some of the things we've been able to do is, like Trena was talking about, with some of the accreditations. We've had people come in and actually see us from throughout the state and other places in the country. HRSA, the Health Resource Service Administration, which is really the administrator of the grants, it's a branch of Health and Human Services in DC. They have sent people here to kind of look at this collaboration and the cooperation that we have here locally. So, and then they take that back. So I think that's a testament, though, to the cooperation and the passion that everybody has. Just like you talked about Mandy, her passion for what she does, Trena's passion. Everyone that comes to our meetings, you've seen it before, it's the passion that people have to make a difference. I don't think any of us want to just mark time.
Right.
You know, you're given one life, you want to make a difference in it. And when you're in healthcare and when you live in a rural community, we're very proud of the rural community. And we want to make a difference in people's lives. And I think we're doing that exceptionally well in Estill County.
Yeah, you ought to be on a debate team.
No, I don't know about that.
But I want to
But
give
you
you.
know, Joe, to kind of piggyback, it's not just, yes, it's the three of us are part of the healthcare system here in the community, but it's also the projects like the Estill Development Alliance, and that's not seen in every other community. So, you know, and you own a part of that cooperation by leading that. So I do think, as a retiree from the military and my husband, we've moved around quite a bit, and I can tell you what we have in Estill County is nowhere in the country that I've ever been, and I've been one or two places in this lifetime. So,
Well,
yeah.
thank you, Trina. I'll have a cookie for you here in just a
Yeah.
minute.
And I have to agree with both of them as
Yeah.
well. I'm not from Estill County.
Mhm.
I'm from Powell County, and I've worked in other counties, and never have I ever seen a community come together and work on projects and see the need in the community and say, hey, let's do something about it. You hear people say, we need to do this or we need to do that, but I've never seen a community actually come together and really focus on getting it done like Estill County does. And they do truly come together and work. And if they say that this is something we need to do, they do it. It's not just something that they say it needs to get done and just wait for somebody to do it. So it's amazing that the way that everyone here works together. It really, truly is.
It's not just healthcare, like
Yeah.
these guys are
Right.
saying, you know, it's Save the MAC, it's the Kentucky Steam Heritage, it's the ATC that the school system is gonna build. So, it's everything. That's what it is. So that's why we have fun. It's challenging, but I think we all have fun. We enjoy our jobs.
So we're just a little nuttier than they are in other places.
Yeah, you know, I don't know, it's all
Get
relative,
after
I
it, you know?
think, isn't it?
This is definitely a community that is very loved on many different levels.
Well, that's very nice, very nice. Y'all got me completely off script now. I had no idea where I was going next.
So you didn't know we had that plan.
I tell you, I'm feeling the love here. But it's encouraging to me when I see, which I don't know healthcare. That's not my wheelhouse. I don't speak the language at some of those meetings.
We don't know EDA.
Well,
so-
you know, but you'll be spitting out, you know, it took me 6-7 years to figure out what HRSA stood for, and that's where the money was coming from. But it's always been encouraging to me to see the leadership in the different spheres that overlapped and how everybody was willing to move forward. And I mean, at this point in my career, I mean, going back, you know, 12, 13 years, I'd go to regional meetings with, you know, economic development folks and what have you, and talk about some of the things going on here. And, you know, they'd kind of be like, for real? You know, you're joking. You know, this entity does not get along with this entity, and somehow or another we've managed to do that. So it's encouraging and it's noticed. It's come back to me. What I wanted to ask John next. Could you give a great promo for our EMS with the caveat that you can't brag on Jimmy Wise at all?
Oh, okay. Okay, all right. Yeah, he's already paid me money to do
Oh,
that.
man.
Yes. You know, in a previous life, I was involved in EMS. I'm actually a paramedic by training and still maintain that, and worked at the University of Kentucky Aeromedical Service. So a pretty extensive background in EMS, and I can tell you with our service here, the citizens of this community are getting a top-notch level of care. And that doesn't come by accident. It comes by the dedication of Jimmy and Sheila and Darren and the leadership at EMS and our board members, Margaret Wood and Steve Garrett and Tom Whitaker. The only agenda that folks have is to provide excellent care to the people here. And so, you know, I'm going to be biased with that. I'm going to tell you that certainly for a rural service, we have an excellent service.
I have personally, I've heard that all around the state. Anybody that's connected with emergency management or with healthcare, and I'll tell them I'm from Estill County, and that's normally they've crossed paths with Jimmy at some point, but they always have a shining review of our emergency medical service. So.
And they enjoy their job. Mm-hmm. So if you enjoy your job and you're passionate about it, it makes all the difference in the world. So.
What's the cliche? If you enjoy your job, you don't work a day in your life.
It's not work. That's right.
Right. Well, Mandy, and I'll let you add in anything else that you'd like, but you've mentioned kind of the data and the studies. What do they lead our folks in public health to believe will come about with the syringe exchange?
I hope that people will see that, you know, it's not just about the changes of the needles, that it is about the prevention of diseases. It is about protecting the public. I did bring a few numbers with me that I wanted to kind of share with you, the overdose numbers in our community. Last year alone, we had 68 overdoses in this community. We're already, and this was as of June the 24th. I haven't talked to Jimmy and Sheila recently to see, but we were at 39. I mean, that's almost over, well, actually over half.
And we're at 47.
Okay, so see, we're up from that. And so, you know, people don't realize, I think in small communities, you have a lot of out of sight, out of mind. If they don't see it, it's not really happening. And a lot of people don't see what's going on, you know, behind the scenes, that these overdoses are occurring. The number of Narcan that's being given to patients, and a lot of times they go out and they give Narcan to somebody, it's not just one dose. It's 2, 3,
Right.
4, 5 doses to bring somebody back. And so I hope that people will see with the syringe exchange program and the HELP project, or the Project HELP, and the things that the hospital's doing, that it's all to work together to prevent the public and to keep people safer and hopefully live longer, healthier lives. Because that's what it's all about, is the prevention. The prevention of diseases, the prevention of harm things coming to the community.
Right.
We want to protect the public, and that's what all of our goals are, is to protect the public and to protect the patients.
Well, and I know with most programs and projects like this, you know, they like to say the proof is in the pudding. So how is the progress, or just how everything moves forward, how is that to be tracked?
We are actually tracking by paper currently, but we're working on an electronic program that we're going to hopefully start up within the next couple of weeks. So we'll actually be able to see how many needles we've got going out, how many are coming back, who's bringing back, who's not bringing back, you know, where are these going? So that way we can keep law enforcement and EMS up to date on what we're doing and where the syringes are going. We're also encouraging people to bring in needles that they see on the street. And most of the participants that we've had so far all says, you know, if I see them, I will bring them back in. So we're hoping that we can be able to use that data and share with EMS. And in the process, we've actually worked with EMS on the OD map. And so that's something that we've got going as well. So we can see if there's hotspots going on in the community where more overdoses are occurring, so that we can get information out to them and start tracking those things as well. So it's not just tracking with the syringe exchange program, but it's tracking with the OD map for the overdoses. Are they happening more in Richmond and Madison County, Powell County? When are they going to come to us? Because we know if it's happening in our surrounding counties, it's going to happen here. But the Drug Task Force team, that's something that we work with Sheila and Jimmy, is saying, okay, we see this happening around us. What can we do to prepare for that when it hits us? Because we know it's not a matter of if it's going to, it's a matter of when.
Right.
And so the whole tracking purposes of all of it, not just the syringe exchange program, but we can get it all and try to get a handle on the things that's coming down the line when it hits us.
Right.
It's real-time tracking too, so we track all of those in this community. We had a representative from the HIDA task force, that's a high-intensity drug trafficking task force, and that's a detective in Richmond. He came and did a presentation 2 weeks ago to our overdose task force here, and that overdose task force, like Mandy said, is really multidisciplinary. The police are involved in that, public health, EMS, the hospital. And so what we're doing is gathering data to determine, like she was talking about, where's the influx of drugs. We know most of them come from Cincinnati. So we know there comes an alert through that OD map system. If we see a trend in Cincinnati, we know it's going to be here sooner or later. So typically within a week.
Wow.
And so that education, you know, helps all of us in different aspects. It helps the hospital to know to be prepared. Do we need more Narcan? Do we need more of this? Do we need more of that? But it also helps us with the syringe exchange program, so that when people are coming in, we can say to them, know where your drugs are coming from. Know who your dealers are and where they're getting it. Know what medications you're putting into your body. Start slow. You can't take anything out, but you can put more back in. So it just kind of lets us know, hey, these are things that's coming down. Watch for these things and know where you're getting your stuff from. And again, that leads back to the prevention and the harm reduction parts of it. Is if we can start them on the lower end and we can prevent these things from happening, it helps them on the upper end.
Right.
With the hospital part.
And it's so big, the issue of addiction, and you know, whatever term you use, there's no snap your fingers and okay, well, we fixed that. But for the average person who's concerned And, you know, because at this point, just about everybody has been touched one way or another. What can that average person that just wants to help, they want to figure out what's something that I can do to make things better? What's out there that they can do?
You want to take that one?
Sure. Well, and I think you're right, Joe. Everyone in the community has been touched by this particular issue. And as we're trying to be the one-stop shopping, the other things that we want to do is involve families in that. Because the person that's in addiction, that affects the entire family. So there's going to be counseling and other wraparound services for families and things of that nature. Some of the things that people can do as volunteers to help, like what Mandy is talking about, to get the information out. As soon as we get everything, the planning phase over with, and we're ready to roll this out, we're really just going to blanket the area, a one-stop shopping number, a one-stop shopping web address or website, and those kind of things. So I think awareness is big for people. And I think people know, I mean, the way you really combat this is hope and hearts, if you think about it. People need hope. If they have hope, then hearts are changed. Right. And so that's what we're looking at doing with that. And you got to have hope of a job. You got to have hope of education and hope of housing and those kind of things. So everybody's involved in it. Awareness right now to where to go. Awareness to what addiction looks like in the prevention phase when we go all the way down to the middle schoolers. So I think that's the key right now, awareness, and be able to know where to go and to access that help.
And if I can say this, John keeps mentioning a one-stop shop. If you think about it, and I hear people say this in the healthcare system all the time, well, I went to this doctor and this doctor told me this, and I went to this doctor and this doctor told me that, and then I go over here and this one doesn't talk to this one and that one doesn't know what's going on, so this doctor gives me something totally different. This one-stop shop that he's talking about is going to be one-centered unity that they can go to, and no matter where they get sent, every person's going to know what to do and how to do it and how to help them. So, you know, if you think about the overall picture of it, this is a pretty great thing. Because it's going to help a lot of families, a lot of people who are, you know, touched with addiction. It's helping them all to know what's going on. If they get sent here, this person knows what to do. If they get sent here, this person knows what to do. And this person's talking to this person, so they know what's going on to treat them as a whole. Whereas healthcare sometimes doesn't always do that.
It's fragmented, and that's what we're trying to prevent. So if a teacher at the high school you know, maybe has some concern about a student, they know how to access the system. If a primary care provider at Mercy Primary has one of those issues, they know how to access the system. If someone in the EDA, you know, needs to talk about something, they know how to access the system. So it's designed that anyone, anywhere has the same amount of information. And that they can just call the one person or access the one person, and then the ball starts rolling, so to speak.
So that for issues with addiction, this becomes Google.
It does.
Yeah, it does.
You got a question,
Yeah.
you go right to it.
That's a good way to put it.
And it's your local Google.
Yeah.
So it's not like you're going online and finding something that's out in Connecticut somewhere.
Right.
It's your local. And that's what makes it so special, is because they can stay right here and get the help that they need.
That's wonderful. And I hope for some of you that this is the first you're hearing about some of this, that this does give you hope, that there are a lot of folks working on trying to, you know, there's not one answer, but to try to bring more answers to the table and make sure that when you need help, it's easy to find. And yeah, in a nutshell, I applaud the work that all you all do, and it does take a special person to work in healthcare. I'm a bit too squeamish to ever be in a clinical setting, so my hat is definitely off to each of you. We've almost got our entire time here, and it flies when you're having fun. But is there anything that we haven't hit on that any of you would like to fill in?
I just want to say, if there is anybody that watches this, that does desire to get into the program, to get help, go to the health department, come to the hospital and let us know, go to your primary care provider. We'll get you what you need to get, you just have to ask for it. So, even the first responders, a lot of people don't know that in Kentucky there is a law that if you go up to, and the name has escaped me, John,
The Angel.
Yes, you can go up to law enforcement and say, I'm done with addiction, I need help, and they will work with you too.
Wow. Wow.
And I want people to know the syringe exchange program, when they come in, it is a judge-free program. Like, they're not gonna come in and we're not gonna look at you and say, oh, you're a drug user,
Right.
or we're not gonna look down on you. We want them to know that that is a safe place that they can come, and if they've got an issue or need help with something, we can get them in touch with the hospital, we can get them in touch with Foothills or wherever we need to get them. The same, we can connect them into this unity that we've got and get them the help that they need. But we want them to know that there's not gonna be harm that they're gonna face back into the syringe exchange.
People want to help,
Exactly.
We kind of always say, I've said for years, no one, at 9 or 10 years old said, I want to grow up and be addicted to drugs.
Sure.
They had aspirations and they wanted to do things in life, and some choices and some bad things occurred, and they find themselves where they are. But there are people that want to help right here in the local community, and there's resources for that. There's resources to put people on a different path, and so all they got to do is reach out and be willing to do it.
There is hope.
Yes.
A lot of times people think that people who are using, drugs or whatever are younger kids.
Right.
That they start at a younger age, but in fact, the median age is about 38 to 40 years old.
Right.
And so you've got a lot of your older population. I think of myself, and I'm not ashamed to say this, but I'm 41. I think of people my age, who are addicted to things that they can't get away from. These are times that you should be thinking about retirement and grandkids and things that your life could go to that is, kind of a celebration of all the hard work you've put in all your life. And to think that they've got an addiction that they can't get away from and don't know where to turn for help, it's kind of sad if you think about
Right.
it. Because it's not these young kids all the time that are, addicted to the drugs, it's the older population.
Right.
Yes.
And no one's too far gone.
Sure.
I mean,
Exactly.
so if anybody's watching and they think that's not the case whatsoever.
There is hope.
There is hope.
Exactly.
Well, and to lighten it up just a little bit before we go, you mentioned Ariel Estes earlier. She asked me several years ago to be a model in a photo shoot they were doing up at the hospital, and I got I had the gown, and they messed my hair up and had to keep powder in my face because I was sweating. And I had a really nice photo with Billy Kelly
Okay.
that has been used many times, and I believe was sent at one point to all 55,000 Mercy employees. Is there any way that you could make it to where I put her in a situation for a photo with her hair messed up and can send it to half of the country? Can you make that happen for me?
Sure. Yeah.
You heard it here first,
I'm really hoping
folks.
Ariel's not watching right now.
Watch out, Billy.
I'll add that on my list.
Okay.
It's
Okay.
probably way down on the bottom.
Okay,
just to
that's
let you
fine,
know.
as long as it's on there.
It's more of an undercover project
Yes,
there. I think,
that's-
so.
We'll have to make that happen.
Okay.
But Mandy, Trena, John, thank you all so much for taking the time and for sharing all of your knowledge and expertise with us tonight.
Thanks for having
Yes,
us.
Joe.
Definitely. I'll leave you with this. Got a few things that are coming up soon. Next Tuesday night, River City Players is having a Bring Your Own Chair event. If you'd like to come out and hang out on Main Street and wave at the cars as they go by. It's kind of nutty, but they will make it work, and I guarantee you it'll be a lot of fun sitting out there and hooting and hollering and waving at folks. You can check that event out on Facebook. Coming up, let's see, July the 27th, we've got Weekend on the Water. It's going to start at 11 o'clock that morning. It's a Saturday out at the rec park. It's going to be a huge fun day out there floating, kayaking on the river, having a good time. Also, we will receive our Trail Town certification at 10:45 to kick everything off that morning. So really excited about that. And the following day, on Sunday the 28th, that's the big choo-choo day. So be watching social media and everywhere else for all the events going on Sunday afternoon as we welcome the 2716 to its new home. And with that said, representing Estill Development Alliance, I'm Joe Crawford, and we'd like to thank WSKV for handling our sound and our live stream this evening, Steam Engine Pizza Pub for hosting us once again, and for our annual sponsors, Citizens Guarantee Bank and Martin Wallace Hospital. So with that, thank you all again, and we'll catch you next time.